I think at 67, I'm working hard to defy the stereotypes of what late 60s look like. And I want people to realize that you don't have to, in a sense, grow old. You can remain healthy and vibrant and hold on to the dynamic of youthfulness.
We are doing something that the body is already doing. We are using the stem cells that you have, but that we get somewhere else, to put them into your body so they help to fix those problems that are constantly happening and keep you healthier for a longer period of time.
I had a wrist injury and I could barely move my wrist. I couldn't use it to hold things. A couple of weeks later, I forgot it was injured. So the healing was so significant that I literally lost the memory of the injury. Hey guys, this is Erwin McManus, and this is the Mind Shift Podcast. I'm here without my partner, Erwin McManus. We're going to dive in with a friend of mine, Dr. Victor Urzola from Costa Rica. We're going to talk about mental health, or physical health, and how to drink from the fountain of youth. I was a part of an incredible place called RMI in Costa Rica, and they took me through some processes with plasma replacement and stem cell therapy. And I wish I could explain all the nuances, but that's why I have Victor here with us today. Victor, it's so good to have you.
Likewise, it's a pleasure to be here. Thank you for having me.
You know, Victor, one of the things that I've had the pleasure and privilege of experiencing is you from both sides. You're a reconstructive surgeon, and also you started RMI, and I'm not sure of the technical language, all that, but can you just kind of give us like a 5-minute background of how you ended up starting RMI?
Okay, well, I'm Costa Rican born. I became a doctor here in Costa Rica and then did my training in plastic surgery in Milano in Italy, and microsurgery in France, in Nancy. And I then went on to Hackensack Medical Center to do a fellowship where I met Dr. Giampapa, who is the other co-founder of RMI. We became very good friends and started working on stem cells. This is around 15 or 17 years ago. And then we decided to bring the project to Costa Rica. I was the person who pushed the law for stem cells to be approved as a therapy in Costa Rica. This is around 11 years ago, 10 years ago. Okay, and then we started RMI and opened our doors to patients around 4.5 years ago, more or less. So this is a little bit the story. I have done multiple fellowships in this segment in genetics and genomics and in cellular engineering. And basically, we put a team together here in Costa Rica. We put a state-of-the-art lab together with microbiologists and molecular biologists. So it's a very interesting thing because we have full control of the whole product, since the umbilical cords are collected all the way to the fabrication of the actual therapy and the administration of the therapies under very strict protocols of safety and efficacy that we have developed over the last 15 years, more or less.
But your specialization for years has been plastic surgery. And so,
concomitantly, I have been a plastic surgeon all this time. I've been a plastic surgeon for around 19 years now. I've done around 7,000 surgeries so far. And part of what I have done, is a lot of reconstructive surgery, especially facial trauma and hand trauma. I also do a lot of aesthetic surgery like every other plastic surgeon. And, stem cells was my hobby. It was something very interesting to me. And it little by little became into a very serious hobby, which led to the foundation of RMI. It was very interesting because one of my stages while in Milano, in Italy, was in a place called Niguarda Hospital. It's the center for burned people in Italy. And while working there, we were treating very severe scars resulting from people who got major burns with fat transfers. We were injecting fat right under the scars, okay? And these scars were improving significantly. They were becoming softer and they were becoming, more supple. Sometimes when people get burns, they get contractions of joints, and it's very hard for them to extend completely the joints when the burns are in flexion or extension areas. And so we were treating them this way, and people were regaining their, mobilization ranges, and basically we understood that this was because of the mesenchymal stem cells that were present in the fat of these patients that we were collecting from somewhere else and injecting under the scars. And I then understood that, these mesenchymal cells have the capacity not only to stop inflammatory processes that are ongoing, but also to epigenetically reprogram the resident cells into behaving better, like, they do. So this is basically the magic, which is actually a very biological process that happens within our body. We are born with a number of stem cells, which are basically three major types. We have hematopoietic stem cells, mesenchymal stem cells, and endothelial progenitors. And basically, from these cells, every cell of the body can be formed. When they commit into more defined cellular lines, you can basically form any other cell of the body. So when you understand how to collect them in an efficient way, how to store them, and how to check the numbers and viabilities of the cells you're using, and you understand how to mix these cells and what doses to use, then you accomplish really, really good therapeutical effects. And this is basically the magic behind the science,
So it seems like an interesting leap when you talk about like plastic surgery to regenerative medicine. But it seems like a huge part of what you were focused on is not really just how does a person look, but how does a person reclaim the quality of their life?
Yeah, of course, because as plastic surgeons, well, when it comes to reconstructive surgery, our goal is to restore function, but, there's always this implicit necessity to restore also the aesthetic component, in case, of trauma patients, right? Mm-hmm. And of course, in aesthetic patients, everyone wants to look good. And I always kept on telling Vincent, we're just makeup artists. We're making people look, better, by, tweaking a little bit their skin or using, Botox or fillers or fat transfers or, surgical techniques, that, make people look better, but the real problem lies within the body, so it's a little bit contradictory to make you look good when you don't really feel that good,
And I want to dive into that, but I also want to just highlight, you showed me this incredible before and after of, was it a man that was gored by a bull?
Yeah, well, in Costa Rica in the December and January time, we have bull rides here. Okay, it's a very strict and controlled thing because Costa Rica has a very strong policy for animal protection. And so these animals cannot be harmed. They can. I mean, not like for instance, in Spain. When they can, use like these flags or they kill the bulls here, you cannot harm them, but they let them loose for them to be chase other people, or like in the States we do rodeos where they ride the bulls, right? Mm-hmm. So this is a guy who was riding a bull, and the bull went like this with his horn backwards and got his face and basically detached his face. From his head, So he was air transported to the trauma center where I used to work, and I had to do this reconstruction, Yeah, no, and try not to bull ride at home, it's not a good idea.
Yeah, I think I'm gonna pass on that one, and right now in my life. But I did think that what you highlighted about, it's one thing to make a person look good, it's another thing to make a person actually feel good or get better. And it seemed like when you focused on RMI with regenerative medicine, one of the things that really struck me was you guys were telling me that my body has the capacity to be much younger than it is right now. And that if you can work properly with the plasma replacement to clean out my body and then the stem cell replacement, I can actually, in a sense, gain years back on my life.
Yeah, exactly. So basically, what we have tried to do, and basically the concept with which RMI was born, okay, was to actually increase the health span and the lifespan of individuals. Okay, and we have really taken this very seriously in the way in which we have approached this company, because we have really tried to do things that are very, very scientifically based, and with medical evidence that we can, prove it works. Okay, and the concept is very simple. We want to try to replicate your body in the 20s. So, the full concept of the company is to try to use your own cells to produce those things that are produced when you're in your 20s, and to keep those cells that you have in your 20s or early 30s, to the maximum level throughout your lifetime. Okay. So what happens is we're born with stem cells, and we have them all over our body, and basically what they do is when there's injury somewhere, they are attracted, we call this tropism in science, to these injury sites, and then go and help repair those injury sites. Okay. The problem is that when we arrive to 60 in average, the stem cell quantity that we have in our body drops significantly. So you more or less at 60, you're left only with 5% of the stem cells you were born with. Okay. Concomitantly, since we age, the senescent cells, which are cells that have aged, and they are, and I like this analogy because it's very easy to understand. It's like a rotten apple in a basket of apples. Okay. So those senescent cells that we have within our body, okay, are cells that we have that grew older, and they start to produce cellular products that make other cells age quicker. Okay. Like a rotten apple in the basket of the apples. Okay. So what we're trying to do is remove the rotten apple, the senescent cell, and we can measure this by some cellular markers that are present when we have too many senescent cells. This is called P16-INC4A and beta-galactosidase. So we can measure this before. Then we give you a treatment, a cellular treatment, to remove those senescent cells, and then we can measure afterwards the presence of these markers that significantly drop. Okay. But so drop other, inflammatory markers. Okay. So basically what we're trying to do is, with the plasmapheresis, remove the plasma that you have dirty accumulated in your body. 60% of our body weight is water. So we remove that water and replace it with new water and albumin. And if you will, I like to compare this to changing the water in your fish tank. So our skin is the glass in the fish tank, the water is the plasma, and the little fish is our cells. So we want to clean that plasma in which our cells are swimming, and then replace albumin, which is very important to keep oncotic pressure and for several biological processes. So we're basically doing these things, trying to incorporate molecules that you have at a younger age, and this is what's coming in the future: the use of vectors to increase the concentration of proteins like clotho, PGC1 alpha, follistatin, H3, to try to increase the lifespan of cells, to try to increase the muscle production capacity, to try to increase the mitochondrial biogenesis, and to try to give, neurological, cardiovascular, and renal protection to our systems. So basically what we're trying to do, and the philosophy of our company, is to try to use all these, things that, we're constantly developing to emulate your body and the physiology of your body in your 20s. Okay. Of course, as you grow older, then you accumulate injuries. You do a lot of sports, so your knee gets wrecked. So we have developed a protocol to treat, these type of injuries with very good success rates and extraordinary safety rates. It's a very, very safe procedure, and this is what we've treated around 5,700 joints with a perfect track record. Worst case scenario, you get a little bit of inflammation that we call a flare. It hurts a little bit for maybe 48 hours and then it goes away. And this happens like in 0.2% of patients. But most patients just get the injections and they can go have dinner at night, and then these cells are placed, in the right place. We do a 360 approach to your joint, treating not only, the inside the joint, but also the tendons, ligaments, and muscles around the joint. We also go inside the bone, right under the cartilage growth plate, and basically treat these joints at a 360 approach, which has excellent results in improving the function and decreasing pain perception. As the cells start to work over a 6 month period. So basically, we've been doing this for also erectile dysfunction. In the patients that have refractory erectile dysfunction to treatment. So basically, you take Cialis or Viagra and you're not able to get functional erections. We treat them by injecting these cells, this combination of cells in the cavernous bodies of the penis under ultrasound guidance. And people, in average, after 21 days, a very high percentage of them get functional erections, which is really amazing, So these are the things we've developed another protocol for skin, and we measure before and afters, using high picture resolution technology, so we can compare, your resulting time, and people improve a lot, with this as well. So, basically we're developing constantly new science. We have a research department within the company, which is constantly trying to improve this, and get new protocols that are, science based. And that render very good results. We're starting to work also on cognitive protocols, using high technology to target specific points in your brain and deliver cells to those specific areas that need the treatments. So this is a little bit what we're developing as, the company grows and we get better doing this.
Yeah, that's amazing. I just want to do a disclaimer that I have not been through those last two processes.
No. These are things that we're constantly developing, and what you went through was the plasmapheresis and the cellular infusions, right?
Yeah, and what's crazy, one is you guys told me that I was the most damaged body you'd ever had in your center with all the injuries I've had in my life. But when I went through the stem cell process, I came out with a sense of euphoria. I could not believe the energy I had, the absence of pain, and the incredible sense of energy I had. When I came back to LA, and I actually spoke in LA that weekend, my kids were like, "Dad, it's like you're on cocaine. You have like so much energy that we don't even know what to do with you." So I don't know if that's a normal response, but I definitely had a physiological reaction to the process.
Well, if you think about it, it's a very interesting thing, like inflammation, is one, if not the most important root cause of cellular disease. And inflammation is a concept that links inflammation to the aging process. Okay. When you have an inflamed joint, it's painful to move it. It's difficult to move it. If you have an inflamed body, it's very difficult to, function. When you drink too much and you get a hangover, what happens is that product, which is a byproduct of the metabolism of alcohol in your liver, can basically crosses the blood-brain barrier, and injures the neurons, and you get brain inflammation. This is why you have a headache. Okay, so imagine that you're constantly inflamed. You have an inflamed body. Then all these physiological processes are very hard to accomplish, and this gives the end result of you not feeling well and not performing well. When we're able to clean all this inflammation out of your body, and we give you all these cells that are going to go talk to the cells that you have in your body and tell them, look, stop producing inflammation, stop producing those mediators that get you inflamed, and start working like we do. This is what stem cells do. It's like, the good friend that comes and tells you, don't drink, come work out with me and have a healthy life, and let's go to sleep early and wake up early tomorrow to exercise. That's what stem cells do in your body. Okay, we figured out a way how to produce them in a way in which they are of really high quality with very high availability, and we understand what the right doses to give patients is so that they accomplish that therapeutical effect that you got.
So when is it too soon to do something like this, and when is it too late?
Well, I think that the most important thing, I just became a dad, 3 months ago. And
Congratulations.
thank you very much. I'm very happy. My first daughter. And one of the things that I think I'm going to do as soon as the time comes, when she's, a teenager, is I am going to put her on a biobanking protocol. We basically use an FDA approved medication to mobilize the stem cells from your bone marrow. Okay. And we can collect those three types of stem cells that I mentioned before: hematopoietic, endothelial progenitors, and mesenchymal stem cells. Okay. And we have a bank, that we put those cells, for future use when these technologies are going to become better and better. Okay. It is very important because one of the most important things that happens as we age is we develop immunosenescence. And when your immune system becomes old, it has a much, much harder time fighting diseases, and fighting viruses, fighting bacteria, but also fighting cancer. Okay. So those hematopoietic stem cells that we're saving at an early age, and these can be saved at any time in your lifespan, the best thing to do is to harvest them as quickly as possible. Then these cells in the future, we strongly believe that it is going to be possible to use them to fix your immunosenescence. Okay, we have several patents right now on how to enhance hematopoietic stem cells to improve the way in which they function. And when we do the research on this, we probably will be able to use this to improve your immunosenescence. Okay, so it's important to biobank these cells, and people save money in the bank, or they invest in gold, or in land. I think a very smart thing is to invest, into saving your cells. Sort of like people that save the umbilical cord or the umbilical blood of their kids when they're born. So my generation, I'm 48, couldn't do this, because it was not available back then. But now you can do it with this methodology that we're using here at RMI in Costa Rica.
And um, I understand the stem cell process can help you heal from an injury. But what if you don't have any injuries and you're in pretty good health? Is this still valuable?
Okay, we treated a professional soccer player,
Okay.
who's 32 years old. Okay, we helped him fix his knee.
Mm.
Okay, and I'm very happy and glad that you brought this up. Because I was telling him the problem is that athletes wait until it's broken to fix it.
Yes.
Okay, and that's a really bad thing to do. So this is like if I told you, okay, buy a car, never take it to, maintenance, and when the engine, burns down because you never replaced the oil, then you change the engine. This is what we're currently doing. We have a completely different vision on how to approach this. We believe medicine should be preventive, proactive, and personalized. Okay. And the right time to do these interventions is before your knee breaks or your elbow breaks or before you get old already. Okay. We are trying to slow down this injury process, and this inflammation process that at the beginning is very little, but as you grow older, becomes bigger. So I told this soccer player, what would happen, okay, if I start treating your joints and those microtraumatisms that you're accumulating in your 20s, okay, to make those ligaments and that cartilage stronger so that perhaps it didn't break. Because if you think about it, if you have a rope and you use that rope too much, little by little, this rope becomes, older and less strong, and some fibers start to break. If we could intervene there and avoid those fibers from keep on breaking and perhaps even fix them, then that rope might never break. And this is exactly what happens with our joints and with our organs. We start to accumulate injury as we grow older. And the idea here is to prevent this injury from happening by using biologicals that you can basically get there, and they keep working in your body for a period of time to, help you fix and keep this, system working better. we are doing something that the body is already doing. We are using the stem cells that you have, but that we get somewhere else, to put them into your body, so they help to fix those problems that are constantly happening and that are making your system become older and more injured as time goes by. So we're trying to put this, line back and keep you healthier for a longer period of time by avoiding these micro injuries and these, inflammatory processes that end up destroying our cells or tissues, and they have an impact in the way in which our organs work, which has obviously a clinical outcome in us feeling sick or with pain or, inflamed.
Well, just from personal disclosure, Kim and I both, I went once by myself before I brought my wife, and with a friend, and then I brought my wife Kim, and we're probably opposites. I love every new innovation, every new medical breakthrough, every advancement, and I'm game. I'm like, let's see how it goes and experiment on me. And my wife would be the opposite side of that spectrum of I want to make sure it's so safe and so certain and so medically approved and all the way through the whole process that it took probably over a year for me to convince her to go. And when she went through the plasma replacement and then the stem cell process, it was like night and day. I mean, the wife I have after, in terms of her energy, her mobility, everything is dramatically different than before, because she had so much developed inflammation, and and it really was dramatic. And so I can just say from our end, I'm like a huge fan. And the whole dynamic of regenerative medicine, which is where you get your name, the idea that you can almost gain back years and years of your life. I mean, I had so many injuries, and one of the funny things about it was I had a wrist injury along with knee injuries, shoulder injuries, all kinds of stuff from all the years of sports. And I could barely move my wrist, and I couldn't use it to hold things. And a couple of weeks later, I think it might have been Patrick or someone who sent me a text and said, "Hey, how's your wrist?" And I said, "What about my wrist?" I forgot it was injured. And so there was a funny thing about it was that I had other injuries that I remembered. I'd completely forgotten that I had any pain or any weakness or any injury in my wrist. So the healing was so significant that I literally lost the memory of the injury. And that for me was pretty extraordinary, because I just turned 67 years old, and my body feels better now than I think it did at 47, which is for me really exciting, because I'm 3 years away from 70, and I'm looking at how am I going to experience my 70s. And it's really hopeful when I go, wow, I can experience my 70s like I thought I was going to experience my 30s. And I think that for me is why I love what you're doing, and I love the innovation and the commitment to help people live the most vital life possible.
Yeah, I think as doctors, this is a very big pleasure for us to be able to help people feel better, and function better. And it's very nice, that story with your wrist, because see, the same thing happened with my dad, So when 15 years ago, now everyone speaks about stem cells, and it's little by little becoming a very common thing.
Right.
And, it's now more and more accepted everywhere. There's so many people that came already to have treatments with us, that, I mean, word of mouth, just, and like your experience, other people here, so they feel more comfortable, and they keep on coming to try the therapies, But 15 years ago, when we were starting this, this was really, really like, a very, very, like weird subject to speak about. It's very unorthodox. Of course, I was, a young plastic surgeon formed in a very orthodox system, with everything, like the pharmaceutical approach to everything, right? So I remember at the beginning when we were developing this, we would test everything on Vincent because he's like you, more brave. I'm more like your wife, Eh, and Vincent would volunteer to try everything, So it was very, Vince, how do you feel? Oh, no, I feel amazing. So then I would try it on myself, right? Um, and at the beginning, my dad is now 76, Around 10 years ago, I would say, he's really flat-footed, and when you're flat-footed, the inside of your knees hurt, end up getting a lot of injury, right? And he was having a lot of problems with his knee, and so I told him, Dad, come in and I'll treat you with stem cells, and he's like, okay, he comes, we give him treatment, and maybe 3 days later my dad's like, I don't think that worked, and that it's not magic, I mean, it takes some time for it to work, it's not Tylenol, so you need to wait a little bit for the cells to actually work and help you, right? I'm a farm boy during the weekends, I'm into horses, and I love to go to the farm with my dad and see the horses, and we walk down the farm. It's rolling hills, so he was always having a hard time walking in the farm. And around 3 or 4 months after he got the treatment, we were walking in the farm, and I noticed he was not limping anymore. And I told him, Dad, I see your joint is getting better. And my dad's like, oh my God, I didn't realize, it doesn't hurt anymore, and I thought you were losing your time with that company, like that, So, thanks for that support, Dad. But I'm glad your joint is doing better, So, yeah, there's no magic involved in this. These are biological processes that happen within our body, and we understood them, and we're mimicking the same biological processes by, helping adding these cells into your system. It's a very, very, basic thing, right?
So if someone, and by the way, I've had quite a few of my friends go down there, and after I mentioned it to them, and they've all really left with incredibly optimistic experiences. But if someone were listening right now and was really interested in being involved, it takes how many days to go through this process?
Well, it depends very much on what you do and what you want to do. But most of the things we do, you can get done in 3 or 4 days.
Okay.
Yeah, it's actually a pretty quick process. There's really no downtime involved, So you fly to Costa Rica, everything is pre-organized, so you get picked up at the airport by our staff, and we have a logistics department, and they basically fix you through the process, and some people want to do many things, so they decide to stay a little longer. Normally patients who come back, that are more familiarized and already experienced this normally come back to get more things done, so they stay a little longer. But most of the things we do, can be done within 3 or 4 or 5 days tops.
Yeah, I think one time I didn't have much time. You guys took care of me in like 3 days. It was pretty efficient along the way. But other times I stayed a little bit longer. And, one of the questions I do get, and I think it's important to address, is the ethical questions. People wonder, where do the stem cells come from? Is this an ethical process? And could you explain a little bit about that?
Yeah, of course, by all means. This is really important. So several years ago, when I was working in the regulatory aspects of stem cell therapies, this was something very unknown. There was a lot of ignorance. There still is a lot of ignorance on these regards. And one thing that I always like to clear out is no embryos are ever used in any therapies that we use. Okay, embryonic stem cells require the sacrifice of an embryo. Okay, and then they're not very safe to use because they're more prone to developing malignancies. So we never use embryonic cells. Okay.
And that's an important distinction, because I've been asked that by many people.
Yeah, that's a super important thing. Costa Rica is a Catholic country, okay? And there's a very strong anti-abortion law in Costa Rica. So this is completely, prohibited in Costa Rica, and then it's not necessary to use them, The stem cells that we use come either from fat, okay, or from the umbilical cord, okay. So you can use autologous stem cells, or you can use allogeneic or heterologous stem cells, okay. But these are things that are normally out of fat or out of an umbilical cord, and these are donations, okay, because there's also a very strong law, in Costa Rica for, it's the law of transplantation in organs, so you cannot buy these things; they need to be a donation. And anyways, these things are normally thrown away because nobody needs an umbilical cord. It's something that's thrown away after the babies are delivered. So what we do in the case of the umbilical cords, for example, is we ask, the gynecologists that work with us. We have a network of gynecologists. They tell, look, would you like to donate, your umbilical cord? Yes, I want to donate it. So these ladies get an informed consent, okay, where basically they read what the umbilical cord is going to be used for. They, sign that they're willing to give the donation, and then we follow them through the pregnancy to do a lot of lab work to make sure that they don't have any medical conditions that we don't want to include. These are normally women that are very young, and of course that don't use any drugs, that don't have psychiatric problems, etc., etc. Because we want to keep this very, very clean during the process. We again test them right before the delivery, and then we have somebody in our staff collecting the umbilical cord to bring to the lab and be processed right after the delivery. So, and when it's from fat, you can use your own fat or donated fat as well, which is runs also like the same thing would happen with the donation of a kidney. It's the same type of protocols, very strict protocols that are very efficiently run to make sure that these are clean tissues, and that we don't run into any problems.
It's amazing what exists inside of the human DNA. It's as if everything we need for health and vitality has been placed inside the human body, and then as we grow and understand, we're able to extract the things that actually help us get better, healthier, stronger, and to live more vibrant lives. If someone wanted to contact you guys, what would be the best address, number, email to just reach out to you directly? Not to yourself, but to RMI.
Yeah, I will. I will put this in the caps down here so that it's easier to copy it.
Well, I'm really interested in the development of the cognitive functions because I'd like to keep my brain as active and agile and resilient and dynamic as possible. So as you develop that, I really want to know more about that. I would rather lose almost any function, the ability to walk, rather than the ability to think. And because I think it's where, for me, I get to make my greatest contribution in life. So I'm really excited that you guys are looking even further into cognitive functions and how to help people, fight the rigidity that comes so many times mentally as we grow older. Are there any closing thoughts or ideas that you had that you really would love to share with us?
Well, related to what you just said, we have an extraordinary neurologist in our team. His name is Dr. Antonio Valverde. He has two subspecialties, one in neuroimaging and another one in Parkinson's disease. He's a brilliant guy. And we have been working on developing protocols for several neurological conditions. So, if, this is the case and somebody wants information, we'd be happy to book you an appointment with Dr. Valverde and have him analyze, their case. This is something very individualized, it requires a lot of attention. So it is a possibility. And no, I just, I think you said something very interesting. It is incredible what the DNA holds, And some years ago, Dr. Yamanaka won the Nobel Prize because he was able to take an adult cell and revert it all the way to a stem cell. Okay. So he did the opposite. Normally, a stem cell turns into a skin cell or a cartilage cell or a muscle cell or an immune cell. Okay. He was able to prove that he could make that adult cell from skin become into a stem cell. Okay. And this proved a super interesting concept. When we learn to use our cells, we could probably fix any problem that we have in our body or avoid any problem we have in our body. And I think we have made a lot of progress in this in the last few years. And I'm very excited because I think the future holds a lot of very positive things in biological treatments. And I really think that we're going to be able to help a lot of people. And we are very committed into developing this in a very serious way, in a very ethical way, in a very safe way, and of course, deliver therapies that work for the patients that we're treating.
Well, I am so excited because, in my mind, it's not really about how many days we get to live, but how much life we bring to every day. And I just want to say, Victor, that you guys have been transformative in my life. And I'm really grateful for you. And that's why I never interview people for podcasts. This is sort of a new thing for me, but I really wanted to have this conversation with you, and I wanted to be able to share it with all the people who follow me and Aaron and who trust us. And I think at 67, I'm working hard to defy the stereotypes of what late 60s look like. And I want people to realize that you don't have to, in a sense, like grow old. You can't stop the aging process, but you can remain healthy and vibrant and hold on to the dynamic of youthfulness. And you guys have been incredibly helpful. And I'm really, really, really grateful for you guys.
No, thank you. It makes me very happy to hear you say these things and to hear that, this had such a positive impact in you and your wife. It's as a physician, and I speak representing all the doctors that we have in this institute, who are extraordinary human beings and extraordinary doctors. So I speak on their behalf. It's a real pleasure to hear people having these results, and it makes us very happy, and it gives, all the work that we put into this and the love that we put into making this happen very worthwhile. So I'm very happy that you had these positive results, and we look forward to being able to help many more people. Cool. Thank you for sharing your experience.
Dr. Urzola, man, thank you so much for taking time today. I know Wednesday's the only day that you get to be able to have any kind of conversation like this. So I'm glad we were able to capture these moments together. Cannot wait to release this to the world. And I'm looking forward to my next trip to Costa Rica. I'm hoping I can bring my kids now and they can be a part of this process.
I would love to have you and meet your children. And it was a pleasure to talk to you today. Thank you for having me. And thank you for communicating this to your friends in your social media. And we're here to help, anyone who needs help. So it's been a pleasure for me as well.
All right. Take care. Thank you so very, very much. This is the Mindshift Podcast. I'm Erwin McManus. We've had an amazing conversation about health and regenerative medicine. We're out. Take care.